You are welcome to my channel. Thanks for visiting. Remembering to subscribe, sharing all my presentations, and listening to this very one. Today, it is all about hydralazine. Hydralazine. Hydralazine is not a disease, it is a medication. We want to know everything about hydralazine today. We'll know about the brand names that are available. I don't know which ones in your jurisdiction or country. We want to know the mechanism of action, where we can use it, what are the possible contraindications, how about adverse reactions. I will go through some warnings. Now, if we take it to that'd be helpful. In OBGYN, this is a very useful medication, but we cannot use it in all pregnant women. Which ones? We'll know. In heart failure, we can use it in some. We cannot use it in some people with heart failure. And of course, what about possible adjustments that we need to make while using hydralazine? All will be right here, right now. Let's go. Hydralazine could come under different brand names depending on which one is available in your country or jurisdiction. Maybe a Propylene, Apple hydralazine, Jam hydralazine, Mint hydralazine, or PMS hydralazine. Hydralazine belongs to the class of medications known as Vasodilator. It is an anti-hypertensive agent. The mechanism of action. It is expected to have direct vasodilation of the arterioles and has little effects on the veins. That will be leading to decreased systemic resistance. The direct mechanism through which this is done is yet to be known, so it is unknown. But there are two hypotheses. One, the calcium release from sarcoplasmic reticulum is inhibited by hydralazine. Two, myosin phosphorylation is inhibited in arterial smooth muscle. So, the combination of calcium release from sarcoplasmic reticulum inhibition and myosin phosphorylation inhibition in arterial smooth muscle will lead to arterial vasodilation. Those are the two hypotheses out there. Now, uses of hydralazine. Hydralazine is helpful in heart failure with decreased ejection fraction. I meant what I've put down here, decreased ejection fraction. Why that? In heart failure with high output, no hydralazine. As a matter of fact, that is one of the contraindications, meaning where and when we cannot use hydralazine. We cannot use it in heart failure with high output, no. But heart failure with decreased ejection fraction, yes, hydralazine is welcome. In hypertension, and let me quickly match these two, hypertension and hypertensive emergency, we can use hydralazine. There will be a link under the description. Please check that. That link will take you to hypertension A to Z. There, I've explained in details how to deal with hypertensive emergency. But because I don't want to waste your time here, let me just leave a small reference here that we don't crash the BP down in hypertensive emergency. Also in pre-eclampsia, fulminant pre-eclampsia, eclampsia, and postpartum, hydralazine is pretty helpful. Also in peri-operative hypertension, we make use of hydralazine. But as we continue right now, we will know more how to make adjustments or the exact dose we can use. We'll know more. Let's go. Forms. Hydralazine can be in form of solution for injection as hydrochloride. In that case, you're going to find it in generic form at 20 mg per ml, or Hydralazine, 20 mg per ml. Can be in form of tablet for per oral use as hydrochloride. That will be in generic form as 10 mg, 25 mg, 50 mg, or 100 mg tablet. Administration. Per oral dosages can be administered with or without meals. However, if you administer it with food, the food will enhance its bioavailability. You can give Hydralazine intramuscularly, but when you choose that route, you give it undiluted. Now, intravenous administration. This is the preferred route, but we have to be very careful. It should be added to IV fluid if that is what is obtainable in your jurisdiction. I love that. But if you don't want to add the intravenous Hydralazine into your IV fluid, you want to give it push, then be careful. You have to give it very, very slowly. For example, you can give 5 mg for over 2 to 5 minutes. I will tell you why. It is dangerous. It can crash the blood pressure down, and the person you are trying to help will be dead right before you. Contraindications. This is when and where we cannot use Hydralazine. In mitral valve rheumatic heart disease, no Hydralazine. So if that diagnosis has been made, mitral valve rheumatic heart disease, no Hydralazine. In coronary artery disease, no Hydralazine. In systemic lupus erythematosus, whether we will even get into adverse reactions of Hydralazine, where emphasis will be laid on this. So don't stop watching. Let's go. When there is severe tachycardia, no Hydralazine, please, because Hydralazine on its own can give reflex tachycardia. And when there's hypersensitivity to Hydralazine or any component of its formulation, no Hydralazine. Then, remember I said the other time, very helpful in heart failure with decreased ejection fraction, right? Now, you don't give it in heart failure with high output. I think it's now clear, right? You don't give it when there's heart failure, but the heart failure has high output. No. Still on contraindications, we will not use Hydralazine in constrictive pericarditis. In isolated right ventricular failure, no. In Porphyria, keep it off. In acute aortic dissecting aneurysm, no Hydralazine. In Thyrotoxicosis, no. In aortic stenosis, no. Drug-drug interaction. A tree cannot make a forest. So I will not be able to exhaust all the different medications that Hydralazine may react to. So let your cardiologist be involved. I put OBGYN specialist here because we use it in pre-eclampsia and eclampsia and even postpartum. So let whoever is handling that be involved. If you're a family physician, taking over. You can reduce the journey if you have good rapport with a pharmacist. No? And of course, clinical pharmacologist will also be helpful. So, code me. Drug-drug interaction, I don't have all the list. Contact these good people. Monitoring. BP, heart rate should be monitored regularly while on Hydralazine, either per oral, intramuscularly, and even when you give it IV, you better hook the vital signs machine or cardiac monitor up. Complete blood count. It is necessary because we might be faced with agranulocytosis or anemia. Let's know what is happening to the electrolytes. Anti-nuclear antibodies, no, we'll know why in a bit, because hydralazine on its own and systemic lupus-induced state is a possibility. Renal function test, why that? When the renal is shutting down, hydralazine should be taken off. Liver function test, why that? Hepatitis, hepatotoxicity. We don't want that. So we'll monitor how we are winning. And if we are running into more trouble, on account of which we have to stop hydralazine, we have all this done. Warnings. There may be sudden death. And here I wrote tell the known story. To the memory of, without making any disclosure, I will not tell the name of the hospital or even the country. There was a case of a star, a celebrity, who walked into hospital. She was pregnant and she was having pre-eclampsia. The doctor prescribed hydralazine intravenously. The nurse that will administer the medication had already withdrawn and put it in the syringe. On her way to administer this medication, there was an acute emergency, so she was called, so she dropped the tray and then rushed to attend to Code Blue. On her way back, she just grabbed the tray, but she forgot to check which one was hydralazine, which one was not. Nurses can withdraw different medications into the syringe and then give as being prescribed. Unfortunately, she pushed hydralazine and there was profound hypertension. Well, the patient died. Can lead to that. Please, before you use hydralazine, go over the contraindications that I've listed and the adverse reactions that have not yet listed here, but you are going to reach very soon. In mitral valve disease, hydralazine can give us serious trouble. And what is that? It may increase pulmonary artery pressure, and it should not be used in rheumatic heart disease. Still on warning, any brand of hydralazine containing propylene glycol can be very dangerous. And why that? The propylene glycol can lead to lactic acidosis, particularly somebody is having heart failure or is having COPD. Already you are battling with acidosis in one way or the other. Now you want to help the BP that is now going off the roof with hydralazine containing propylene glycol. You are going to kill the patient with lactic acidosis. That may be hyperosmolality, seizures, respiratory depression, and renal failure. Remember, I said we have to check the renal function test initially. Still on warning, formulations containing hydralazine should be cautiously administered. Why that? This can trigger allergic-like reactions, and that would be horrible for patients with bronchial asthma. Somebody is saying bronchial asthma, do you mean? Yeah, that's cardiogenic asthma. Still on warnings, a pregnant woman having chronic hypertension, that is, the hypertension had been before pregnancy, or it is pregnancy-induced hypertension, that you are now looking for a good medication to help the woman, and you want to choose hydralazine? No, don't give hydralazine on a long-term basis in a pregnant woman with chronic hypertension. Why that? Okay. The mother, who has chronic hypertension will stand the chances of having birth defects. And that birth defect will increase here with hydralazine. Also, there will be low birth weight. Preterm delivery is a possibility, even if it's not stillbirth. And there may be neonatal death. Gestational diabetes, myocardial infarction, pre-eclampsia, stroke, and delivery complications will follow if the woman is having chronic hypertension. Okay, so we have to look for other medications besides hydralazine in chronic hypertension in pregnancy. The long and short of it is we use it just to avoid very high blood pressure, very good in pre-eclampsia, eclampsia, fulminant pre-eclampsia, postpartum, but the BP must be high to warrant its use. So somebody has chosen to go for hydralazine in pregnancy, then it's not the medication we will use on a long-term basis, and then the BP must warrant its use. If the BP is less than 160 over 110 millimeters of mercury, in a pregnant woman, don't use hydralazine, please. Still on warning, in breastfeeding mothers, if you want to use hydralazine, then use lower dose. The lower dose that the woman can tolerate. And when we even choose that, we will use it only for a short time. Examples of where and when we can use hydralazine after we have fulfilled all the requirements and we deem the patient eligible to use hydralazine. Then we can go if there's heart failure with reduced ejection fraction. Remember, I've said this earlier, heart failure with high output, no hydralazine. But heart failure with reduced ejection fraction, yes, is welcome. Even with that, we will not jump at hydralazine first. First thing first, we'll use some other medications like ACE inhibitors, angiotensin receptor blockers if there's reaction to ACE inhibitors. If we're not winning, then heart failure with reduced ejection fraction, we can grab hydralazine 25 mg per hour 3 times daily. The maximum we can give is 75 mg per hour 3 times daily. In fact, I will start as low as 10 mg per hour. Okay. Then you may or not add azoxystrobin dinitrate to it. Then we adjust the dose based on blood pressure and heart rate, please, and watch out for other side effects. In resistant hypertension, we can use hydralazine, but not the first-line agent. We must have tried other agents and we're not winning, then we'll go for hydralazine. Someone is asking, how do you mean by resistant hypertension? I'll not waste your time here. Go back to the description, please. Click on that link. That will take you to hypertension A to Z. There, I've explained in details what I meant by resistant hypertension. So here, you can use hydralazine 10 mg 4 times daily for 2 to 4 days. Then 25 mg 4 times daily for 3 to 5 days. And then adjust the dose with blood pressure. The maximum we can give is 300 mg in 4 divided doses, meaning 75 mg per hour 4 times daily. In pre-eclampsia, fulminant pre-eclampsia or eclampsia, the first question is this woman in labor? If the answer is yes, then we'll get to IV lines. Line A, with oxytocin if so required for augmentation, because she might be having good contractions, right? So if oxytocin is required for augmentation of the labor, one line will have that. Line B, with intravenous Hyperosmolality in IV fluid. Now you can give between 10 milligram to 20 milligram inside that IV fluid. Then you adjust each infusion rate based on contractions in A when you have oxytocin for augmentation, right? And based on BP in B when you have Hyperosmolality in IV fluid. But you may not rigidly follow this. Follow the protocol in your center, please. We must be checking blood pressure every 15 minutes here. And then we adjust infusion rate as per the contraction every 30 minutes. So when we are dealing with this, hydralazine is helpful, but our eyes must be on the blood pressure. And we don't rush anything. We put this in IV fluid and titrate with the blood pressure. You must be checking that every 15 minutes. Or if it is pre-eclampsia, fulminant pre-eclampsia and eclampsia, and the woman is in labor, you might give initial dose of 5 milligram to 10 milligram, then repeat with another dose of 5 to 10 milligram every 20 minutes. But remember, we must be monitoring the blood pressure every 15 minutes, or we'll get vital signs machine on or cardiac monitor. If the BP is not controlled with the dose of 20 to 30 milligram, we'll do something. Stop the hydralazine and switch to another agent or agents. In pediatric age group, well, truth be told, I have never used hydralazine in pediatric age group. Okay, but the literature will help to give us clue as per what we can do. There must be extra focus on blood pressure here. Remember, the younger we are, the higher the heart rate, the lower the blood pressure, expectedly, right? But hydralazine may give reflex tachycardia. Remember, the younger we are, the higher the heart rate. Beta blockers can prevent the reflex tachycardia, yeah. But we have to remember that we are giving beta blockers that are capable of shutting the BP down, okay? And you want to give hydralazine on top of the beta blockers, because we should not forget, we are using beta blockers to handle the reflex tachycardia, but it's dealing with the BP on its own, and hydralazine is coming to handle the BP also. So what's going to happen? Vital signs machine on, cardiac monitor on. Dosage varies from 0.1 milligram to 0.5 milligram per kilogram per dose. Please confirm with your pediatrician and your pharmacist, please. Adverse reactions. In many nursing and medical school exams, and you want to talk about hydralazine and adverse reactions, hydralazine-induced lupus-like syndrome will not take the last position there. So hydralazine can induce lupus-like syndrome when we give it at doses greater than 200 milligrams for about 3 months. But there's a light at the end of the tunnel here, and that is this situation is reversible once hydralazine is discontinued. The lupus-like syndrome can lead to a lot of troubles, like pericarditis, hepatomegaly, and even splenomegaly. There may be bleeding dyscrasias because the individual will be faced with thrombocytopenia, and there could be leukopenia. There may be severe malaise or myalgia, and of course, acute joint pain and joint swelling. The lupus may have a delayed onset in some people, particularly those that are unnamed for a long time. So it can be delayed Now, if you're on the therapy from 1 up to 24 months. The risk factors for the development of lupus-like syndrome. I will let you know that it's not everybody that will take hydralazine that will have lupus-like syndrome. As a matter of fact, it's not going to be the case. But there are certain people that may develop that. And that will be common in females, no? And white race, and doses greater than 200 milligram per day with cumulative dose greater than 100 gram. You can see, when you give hydralazine maybe 10 milligram for 2 to 3 days, we don't expect lupus-like syndrome. No, we don't. So, female, white, very high dose, more than 200 milligram per day for a long time with cumulative dose greater than 100 gram, and individual with family history of autoimmune diseases. Now, maybe family with systemic lupus erythematosus before, but it doesn't have to be specifically systemic lupus erythematosus. Once you have one autoimmune disease, you have to look for other autoimmune diseases. So someone having rheumatoid arthritis, pernicious anemia, type 1 diabetes from autoimmune, Hashimoto's thyroiditis, and the list goes on, can come down with this. And those with no gene for C4 and HLA-DR4 genotype can have it. And also, when the treatment is for 3 months or greater, or there's history of thyroid disease in the family, I've said it, Hashimoto's, Graves', then be careful. Such individuals now taking hydralazine may come down with hydralazine-induced lupus-like syndrome. Other adverse reaction is, like the other time we said, contraindication is coronary artery disease, so myocardial infarction, angina pectoris. I don't even need to point this out again. Hypotension is the first thing that we can run into. Maybe edema, flushing, reflex tachycardia. And of course, we can ignore this, pruritus. Other adverse reactions will include constipation, nausea, vomiting, and diarrhea. And someone will ask me, are you contradicting yourself? Constipation, diarrhea, what will be in one may not be in the other. Anorexia, difficulty urinating, agranulocytosis, eosinophilia, and lymphadenopathy. Let me be back to difficulty urinating. Remember we said the other time, when renal shutdown is happening, keep hydralazine off. So now creatinine clearance is showing less than 10 mils. You still give the hydralazine in somebody who had this before. Okay, there we go. Other adverse reactions include hepatitis. Remember I said earlier under the monitoring, I said we will have liver function test done, right? Now you can add liver enzymes on top because they are two different things. Liver function test is different from liver enzymes. You can check my channel for that. Splenomegaly, I've said already, hepatosplenomegaly is a possibility. Chills, dizziness, euphoria or hypomania, conjunctivitis or lacrimation, nasal congestion, or could happen. Still on adverse reactions, and somebody is asking, why are you, concentrating so much on adverse reactions? Yes, we need to. When the patients know what they are about to face, they will be able to agree or disagree, positively with you. Dyspnea, fever, Stevens-Johnson syndrome, when there's hypersensitivity, right? Toxic abdominal necrolysis. Hemolytic anemia. Remember I said earlier, anemia is a possibility, bleeding discreter from thrombocytopenia, right? Glomerulonephritis. Now, necessary adjustments. When we are placing somebody on hydralazine and the person is on continuous renal replacement, then we give hydralazine only every 8 hours, not 4 to 6 hours. Okay? When somebody is on intermittent hemodialysis or peritoneal dialysis, the person is not qualified to have hydralazine repeatedly within 24 hours. Only once or twice within 24 hours. If the person is on peritoneal dialysis or hemodialysis. If glomerular filtration rate is between 10 to 50 mils, then it's only every 8 hours. And if it is less than 10 mil per minute, then it is only once in 24 hours or every 12 hours. In conclusion, hydralazine is a good medication, but whether you want to be cautious or you want to be careful, pick one, but you must pick one of these. Why that? It can kill, though it can save life as well. So thank you for listening. Hydralazine is a good medication. Go for it, but check all these facts out. Remember to share this very presentation with your friends. Remember to subscribe to my channel. I appreciate your contribution. Let's continue to help human race. Let's continue to share this. Thank you.